Alan Litt is playing his guitar pain-free for the first time in almost 10 years, thanks to hand surgeon Dr. Stephen Troum, a member of the American Society for Surgery of the Hand. Just 3 months ago, Dr. Troum treated Mr. Litt's trigger finger, a common but very debilitating ailment. Today, the two are sharing their passion for music.
The pain was excruciating. I was in pain all the time. My hand was locked, my finger was locking up all the time. I was depressed because I couldn't play, but the constant pain was the worst thing. It hurt all the time. So by the time I came in to see Dr. Troum, I could hardly open my hand, and I didn't want to. I basically kept it comfortable in a comfortable fist like this because that was not aggravating it at all. The pain was 24 hours a day. As soon as it's the first thing you think of when I woke up. It was the last thing I thought of when I went to bed. So basically, that's where I was before I had the surgery.
Well, when Mr. Litt came in, he came in with the classic complaints of trigger finger, and that is his ring finger was catching on him and locking, and it was very painful. It was interfering with his work, but was also interfering with his activity as a guitar player and a musician. Initially, we tried to treat it without surgery, and we put him on anti-inflammatory medication. We also will try steroid injections into the sheath to try and make the swelling and inflammation go down. If that doesn't work, then the next step would be surgery. Trigger finger is basically a tendon problem where you have inflammation in the tendon, typically your flexors in your hand, is where it occurs, and the inflammation causes swelling around the tendon, and that swelling basically causes the tendon to snag inside the sheath, giving you this locking or clicking or catching sensation. You can imagine basically like your belt, a series of belt loops, and imagine tying a knot in your belt. And you might be able to pull it through the belt loop, but it'll pop or catch on you. And certainly if the knot is too big, it won't even pull through. Now imagine cutting that belt loop it's getting caught on. The belt will stay on your waist because you've got all the other belt loops holding it there, but you've cut the one belt loop that is causing the problem. The procedure starts out after we've prepped and draped the patient's hand, made a sterile field. He's asleep, of course. And we'll make a small incision about half an inch or so in the palm, overlying that tendon sheath, and in Mr. Litt's case, it was of the ring finger. So it'll be an incision sort of in the palm. And then we go down to the tendon sheath itself, and the pulley, which is called the A1 pulley, it's the actual structure where the sheath begins, the beginning of the tunnel, as you might think. We incise that pulley and open it up, and then you can see the tendons underneath, and you can actually move the finger and see the tendons gliding the way they should. And once you've had an adequate release, opened up the sheath enough, and the tendons stop clicking, you're basically done at that point. You wash the wound out and close it up.
The surgery was easier than getting your teeth cleaned. I mean, I went in, they put me to sleep, I woke up, and bada boom, bada bing, and it was done. So after about 3 weeks, I had no clicking. My finger was not clicking anymore, wasn't locking up. It hurt, still hurt from the surgery a little bit, but that was to be expected. I was warned about that. And I got to tell you, it was something akin to a miracle. It was great. It was fantastic. I could move my hand again. I could move my finger again, loosely, easily. So if you're out there and you got trigger finger, go see a hand surgeon. So that's my experience.
If you want to seek out a hand surgeon and you'd have a problem with your hand, go to www.handcare.org. It's the website of the American Society for Surgery of the Hand. They have lots of patient education resources on the site, as well as a directory where you can put in your city or your zip code and find a hand surgeon who's fellowship trained and board certified in your area.
It's an irritation. It's a knot in your ligament, and the only way to get help is really just to get that thing out of there. And go see a hand doctor because it works. Oh yeah, Doc. That's nice.
Nice.
Thanks.